Visible and visible to you? Okay. So, myself, Dr. Shital Pipaliya, your faculty for physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. NEET PG free test calendar is there for week 2. You can check with the time and date, and different series is available on the platform. Let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. With iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, you will find various resources like well-structured live batches, recorded classes, question bank, and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. These all are toppers of FMG December 2021. Congratulations to all the toppers from Unacademy. Now Unacademy came up with some special class feature. Now classes will be highly interactive. There will be a poll for the learner for their better understanding. There is also a facility of raise the hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it and you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. There are various batches now on the platform of Unacademy. NEET PG 2022 All Educator Revision Batch. Duration is 2 months. Focus FMG 2022 batch. Duration is 2 months. So NEET PG subscription is available for of different prices and various duration. You can subscribe according to your requirement. So now let us go through the today's topic. That is image based questions. What are the important questions and answers which can be asked or which are already asked in certain exams? So let us go through it. Of cardiovascular system. See, this is the image. Okay, see the image showing various phases: phase 1, phase 2, phase 3, phase 4. Okay, see, the question is phase 4, which is shown in the image, is because of what? Opening of voltage gated sodium channels, closing of voltage gated sodium channels, opening of voltage gated potassium channels, or by sodium potassium ATPase pump. Which of the following can be is responsible for phase 4? Means this one, right? So if such kind of question is asked in exam, then see, very first important thing कि आपको ये पता होना चाहिए कि this is the action potential. ये action potential का image है of the cardiac muscle, right? Cardiac muscle का action potential का image है. Okay, there are various phases. See, this is the action potential in the cardiac muscle fiber, not in the pacemaker. Okay, in the cardiac muscle fiber. See, there is a plate 2, right? Plate 2 है इसमें. So if we see these various phases, after the implication of the stimulus. Okay, once the stimulus is given, then there will be change in the membrane potential, change in the resting membrane potential. Resting membrane potential in the ventricular muscle fiber is minus 90 millivolt. Remember this carefully. Resting membrane potential is minus 90 millivolt. Okay, whenever stimulus is applied and there is a change in the membrane potential, and when it begins at that time, see the first phase, this one, this is the phase of rapid depolarization, rapid depolarization, right? So here, see, unlike skeletal muscle, here not only sodium plays role, here sodium and calcium both plays role. Okay, so the initial part here, there is a opening of sodium channel, voltage gated sodium channel, so there is a sodium influx, right? There is a sodium influx. Later half of the rapid depolarization phase, there is also opening of calcium channel, right? So it will also cause calcium influx. So that is about the depolarization phase. Because of the entry of the positive ions की entry होती है sodium initially followed by calcium, right? So it is bringing the positivity inside the cells, right? So it will bring the membrane potential towards the positive side. Then, so it means that the later on there is a rapid repolarization. This phase is because of the opening of the potassium channel. Opening of the potassium channel will cause potassium efflux. It will cause potassium efflux. Okay. Later on there is the plateau. This plateau is because of the opening of the long acting type of calcium channel and closure of the distinct sets of the potassium channel. And that is followed, this phase is followed by repolarization phase. That is because of the opening of the potassium channel, which causes potassium efflux. Okay, so once the rapid repolarization, it means that there are various channels which plays the role, right? Once the phase of rapid repolarization is over, again it reaches to the resting membrane potential value. Okay, it reaches to the resting membrane potential value. But see the question is asked is that phase 4 means this one, right? So resting membrane potential, later on the ionic balance is achieved by sodium potassium ATPase pump. Okay, so intracellular potassium concentration increases and extracellular sodium concentration increases, right? So to achieve this, we need activity of the sodium potassium ATPase pump. Okay, so phase 4, the correct answer here is D. Okay, the correct answer here is D. By activity of sodium potassium ATPase pump, again the ionic concentration across the cell membrane will be achieved. Okay, so that is the correct answer. Now come to the next question. That is the later phase. See the question carefully. Later phase of prepotential is due to, see this one, prepotential. Okay, understand the question carefully. It is because of the activation of the F channels. F stands for funny channels. Okay, opening of potassium channels, closure of potassium channels, or opening of T type of calcium channel. T stands for transient. Okay, F stands for funny channels. T stands for transient channel. Okay, transient type of calcium channels. So let us understand little bit about this. See this one, this slope, this is prepotential. Okay, this is followed by action potential. This is rapid depolarization and this is rapid repolarization. Okay, so this prepotential, it occurs in the pacemaker tissue. Okay, it occurs in pacemaker tissues. So it means in heart, pacemaker is SA node. So here you can say this is the action potential showing in the SA node. Okay, this is prepotential. See, SA node is having unstable, this is very important, unstable resting membrane potential somewhere near -55 to -60 millivolt. Okay, it is having unstable resting membrane potential. Why there is unstable resting membrane potential? That is because of the presence of the funny channels, or you can say presence of leaky channels. Okay, presence of leaky channels. So what it will do, resting membrane potential, consider it -60 millivolt. So initially it will, leaky channels will cause entry of the sodium. So you can say sodium influx. Okay, it will cause sodium influx. Once the membrane potential changes approximately -5 millivolt. Okay, whenever the membrane potential rises, okay, from, or there is, you can say that 5 millivolt potential change when it occurs, okay, and it reaches to somewhere near -55 millivolt, okay, that time there will be opening of the transient type of calcium channel. Transient type of calcium channel. So that will cause calcium influx. It will cause calcium influx later part. Once it reaches to near -40 millivolt, okay, then there is a opening of L type of calcium channel, long acting calcium channels, okay, that will cause calcium influx and brings the phase of rapid depolarization. This is followed by rapid repolarization because of the opening of the potassium channel. Okay, so see this slope is called as a prepotential, or you can say pacemaker potential. Prepotential or pacemaker potential. Okay, so initial part of the prepotential is by F channels or you can say funny channels or leaky sodium channels. Anyone can be the correct answer. Later part of the prepotential is because of the opening of the transient calcium channel. Transient means those who open up for a while. Okay, so transient calcium channel. So here, later phase of the prepotential, it means that the correct answer is D, opening of transient calcium channel. If the question is asked like initial phase of prepotential is because of what, अगर क्वेश्चन ऐसा है, in that case the correct answer is first one, activation of funny channels or leaky sodium channels. Anyway, if it is written leaky channels for the sodium is correct. Okay, later part is by opening of the transient type of calcium channels. That is the correct answer. So here the answer is D, opening of the T type of calcium channels. Now come to the next question. See the graph. Okay, see this one. This is Frank-Starling curve, right? This is shift to left and shift to right. Okay, on the x-axis it is showing end diastolic volume, and on y-axis it shows the cardiac output. So let us understand the question. Which of the following will cause shift of the curve to left? Shift of the curve to left. Sympathetic stimulation, hypoxia, acidosis, or myocardial infarction. Which of the following? See the middle one. This is Frank-Starling curve. Okay, so according to the Frank-Starling law, what Frank-Starling law says, that initial length of the muscle fiber within the physiological limit, if you increase the initial length of the muscle fiber, greater will be the force of contraction. It is like a stretching of a rubber, right? एक रबर की तरह अगर आप उसको किसी को भी stretch करो muscle fiber को, and if you leave it, then greater will be the force of contraction. But it should be within physiological limit. Okay, so initial length, greater the initial length of the muscle fiber, greater will be the force of contraction. Increase the initial length of the muscle fiber, increase in the force of contraction. So if we say shift to left this side, What can be the correct answer? Sympathetic stimulation, hypoxia, acidosis, or myocardial depression? See, hypoxia, acidosis, they causes decrease in the cyclic AMP formation, right? So it means that calcium availability will be affected. So they are not going to cause a shift of the curve to the left, right? Then myocardial depression means reduced activity of the myocardium. That can also not cause increase in the myocardial contractility, right? So this all cannot be the answer. So the correct answer is sympathetic stimulation, right? Sympathetic stimulation is having all those positive effect, right? Positive inotropic, positive chronotropic, positive bromotropic, and positive bathmotropic action. It means it increases the heart rate, increases the force of contraction, increases the excitability of the tissue, and increases the conductivity, right? So this is because of the sympathetic stimulation. So the correct answer is A, sympathetic stimulation. Now come to the next one. See the image carefully. This one, this is ECG, right? Showing, see, this is labeled, right? So A in this image signifies what? It shows what? Ventricular activity, atrial repolarization, AV conduction time, or atrial depolarization. Which of the following will be signified by A? A is this. See, here what is this arrow is between onset of the P wave to the onset of the QRS complex. Onset of the P wave to the onset of the QRS complex this time, right? It means that this is PR interval, right? PR interval. Now let us have a quick recall of something. P wave is because of the atrial depolarization. QRS complex is because of ventricular depolarization, and T wave is because of the ventricular repolarization, right? So onset of the Q wave, onset of the P wave to the onset of the QRS complex. It means onset of the atrial depolarization to the onset of the ventricular depolarization, right? PR interval signifies that, right? It means that it is signifying the conduction of the impulse from the atria towards the ventricle, right? So here the correct answer is C, AV conduction time. Okay, atrioventricular conduction time, traveling of the impulse from atria to the ventricles, right? So AV conduction time is the correct answer. Now come to the next one. See the image. This is ECG. See, 50-year-old male having complaint of pain in chest on exertion. Pain in chest on exertion. ECG showing the findings and this kind of findings, and the person is diagnosed with atrial fibrillation. Okay, atrial fibrillation. Which of the following is not true? See the question carefully. Which of the following is not true, or you can say which is the false statement regarding this, right? So see the ECG now and see these options. No P wave, which is not true. We are supposed to find out the false statement, right? No P wave, irregular QRS complex, it's a fatal condition, or reduced cardiac output. So before answering this, we should be knowing about atrial fibrillation, right? See, fibrillation means there will be twitch-like contraction of the atria. These twitch-like contraction are not effective, right? They are not effective, right? So it means that in the ECG only we can see this, that there is no clear-cut P wave. So this is true. Then irregular QRS complex, that also we can see, right? There is no P wave, so there is no point of correlation, right? Irregular QRS complex, that is also a true statement, right? It's a fatal condition. This is the false statement. So the correct answer is C. Atrial fibrillation is not a fatal condition. Why? Because of the fibrillation, when the effective contraction is not there, okay, atrial contraction, it means that it is going to affect the atrial contraction. Now try to recall the cardiac cycle, okay. In the cardiac cycle, last rapid feeling phase is coincides with the atrial contraction, right? Last rapid feeling phase of the cardiac cycle, that is because of the atrial contraction, which contributes to only 20 to 25% of the ventricular feeling, okay, responsible for approximately 20 to 25% of the ventricular feeling. So you can say here that 70 to 75% of the ventricular feeling is passive. Simple opening of atrioventricular valve will cause feeling of the ventricles. Just because of the opening of the valve, the blood will move from the atria towards the ventricle. So 70 to 75% of the feeling of the ventricles is passive. Only 20 to 25% is contributed by atrial contraction, last rapid feeling phase of the cardiac cycle, that is due to atrial contraction. So if effective atrial contraction is not there, in that case this 20 to 25% will be compromised, right? So it means that at rest there will be no problem. Whenever the person undergoes some exhaustive activity, okay, at that time there will be in that these 20 to 25% will matter, right? So there will be complaint of pain in chest because of exertion, right? And ECG showing all the findings of atrial fibrillation. But atrial fibrillation is not a fatal condition. Person can live normally, and there can he or she can perform routine activity of rest, okay. Any exertion is not advised, okay. Atrial contraction is affected, so the output, cardiac output, will be reduced because it is going to get compromised. It will be compromising 20 to 25% of the ventricular feeling. So the reduced cardiac output is also correct answer. So here, according to the type of the question which is asked, the exception, the false statement regarding atrial fibrillation is it is a fatal condition. Now the next image, that is, see this one, this is showing the pressure change, right? See the image carefully. This is asked, what is this, right? What is this? So A in this image signifies which event of the cardiac cycle, okay. Isovolumetric ventricular contraction, ventricular ejection phase, isovolumetric ventricular relaxation phase, or protodiastole phase. Now see the image carefully. This one, see, this is the atrial pressure, right? The green line, that is the ventricular pressure, and the red line, that is aortic pressure. See here, aortic arterial pressure is more as compared to the ventricular pressure. Then ventricular pressure starts rising, right? It means that this phase is something about ventricular system, right? See here, AV valves are closed and semilunar valves will open here. It means that during this phase, both the valves are closed. AV valves are closed and ventricular pressure starts rising, but still it is not more than the pressure of the aorta. So semilunar valves are not open in this phase, right? So AV valves are closed and semilunar valves are yet to open, you can say. So ventricular chamber is behaving like a closed chamber. Okay, it is contracting and both the valves are closed. So here you can say there will be no change in the volume. No change in the volume will be there. So this phase, this one, A, that is isovolumetric ventricular contraction. Understand the word carefully. Isovolumetric means volume stays same. Okay, so here what happened, because of the continuous ventricular contraction, ventricle is behaving like a closed chamber. Let us draw this. Okay, ventricle is behaving like a closed chamber and this valves, AV valves are closed, aortic valves are yet to open because ventricular pressure is rising, but it is still less than the pressure of the aorta. So whenever the ventricular pressure, when the left ventricular pressure exceeds the pressure of the aorta, then and then semilunar valve will open and it will cause pumping of the blood in the vascular system, right? So this phase, this part is isovolumetric ventricular contraction. Ventricular ejection phase begins here, this phase, when the left ventricular pressure exceeds the pressure of the aorta and the movement of the blood will begin from the ventricular chamber into the aorta. So, in isovolumetric ventricular relaxation, it is this phase, right, where semilunar valves are closed and AV valves are yet to open. See, here AV valves will open. So, this phase, this is relaxation phase. Isovolumetric means volume stays same, ventricle is constantly relaxing, but still left ventricular pressure is less than the pressure of the, it has to get lesser than the pressure of the left atrium. Then and then AV valves will open, right? And later on the next phase of the cardiac cycle will start, right? So A here is isovolumetric ventricular contraction. Okay, so that is the correct answer of the image. So these are the few images or image based question of cardiovascular system. I will put a stop here because you will have a MCQ which will be conducted by me and Dr. Dipti, available on the platform of Unacademy. Please join us for the test series. Study hard, study with us. Stay tuned for the study. Subscribe Unacademy Future Doctors channel and help us to reach to more and more number of students.